if you're pregnant, then listen up, because most people want pain control during their labor, and that usually comes in the form of an epidural. So let's talk about epidurals. First, the anesthesiologist will make sure that you can have an epidural. So we'll talk about your history, physical, and check some lab work to make sure it's a go. Next, we will get you into the proper position and then clean your back with an antiseptic. Right after, we're gonna make sure to put a sterile drape, once again, to reduce the risk of infection. And then we will give you a bit of freezing and then go ahead with this large needle into your back. Okay, so that's why we tell you not to move, because this is in your back. So we want to reduce the risks of complications, and that's where not moving is super important. Once we find the space with this syringe, which we're going to find a loss of resistance, there will be normal saline in here, or it can be done with air. Then we will thread a catheter, and this is what the catheter looks like. It's very small and it doesn't hurt. This is all that's left in your back, and we will feed that through. Once we've taped up your epidural, at that point we will give you some medication right away so that you start to feel the effects of the epidural within 10 to 15 minutes. Now, I've never put in an epidural where someone has not regretted putting this in. So if you're pregnant, get an epidural.